Thank you, Crystal, for your introduction and your continued leadership. Honorable ministers, delegates, colleagues, and guests, on behalf of the Frontline Health Worker Coalition and our partners Care USA, IntraHealth International, Johnson & Johnson, Living Goods, Pathfinder International, Project Hope, Seed Global Health, and Smile Train, thank you for joining us today. Hosted by IntraHealth International, the coalition comprises global organizations and corporations in 100 countries whose vision is that every community should have access to trained, compensated, protected, and supported health workers who are able to provide quality essential health services as well as respond to pandemic threats, climate change, and non-communicable diseases. In the 4 months I've led the coalition, we've had significant accomplishments. In March, we refined our strategy to better align with the SDGs and reflect a global policy focus. Our expanded efforts encompass the broad umbrella that is the health workforce: doctors, nurses, community health workers, midwives, pharmacists, and other cadres, from the health facility to the last mile. In April, we hosted World Health Worker Week, a global movement to advocate for the global health workforce. This year, we had a worldwide reach of 95 million, an increase of 600% from prior years. The coalition has also been active in advocating for global health workforce issues, including a new line item for the global health workforce at USAID, and pushing for robust provisions and protections for all cadres of health workers in Article 7 of the Pandemic Agreement. Earlier this month, we partnered with the WHO, the Global Fund, the ILO, OECD, WHO Working for Health Multi-Partner Trust Fund to organize the Africa Health Workforce Investment Forum, which brought together key stakeholders in the region to catalyze commitment and action. The forum and its companion charter offer a blueprint for Africa, as well as lessons learned for other regions in addressing human resources for health. We look forward to our continued collaboration. Today, we bring together key leaders and experts to unpack best practices, better understand partnerships that accelerate implementation, and mobilize action to move the needle. In other words, what works and what can we do together to make greater progress faster? Health workers are at the heart of securing our health and well-being. We call on member states to ensure that provisions for a robust, multidisciplinary health workforce are included in all health-related mechanisms and political declarations moving forward. In developing national strategies, we ask governments to likewise take appropriate actions to ensure the implementation of these commitments and to prioritize human resources for health across all cadres of the health workforce and to activate partners in helping them to do so. As partners ourselves, we must do more to support countries in developing, resourcing, and operationalizing effective solutions for human resources for health. This includes fighting gender disparities while promoting opportunities for women's leadership, and ensuring that all health workers, whether they migrate or stay in their country of origin, have the same protections and benefits. Finally, we must reframe our thinking and that of our colleagues in finance and labor to recognize that in addition to health gains, there are long-term financial and social returns to making strategic investments in the health sector. Let's work with other sectors to better articulate the case for increased investments in health and the health workforce. Because without a robust health workforce, not only will goals like health security and UHC be unattainable, but the broader development targets outlined in the SDGs will also be impossible to reach. In closing, I would like to thank my dedicated colleagues at IntraHealth, the incredible Symposium organizing team, and partners, and the Coalition Steering Committee, whose leadership and ongoing support has been invaluable. We invite you to join us in the coalition and look forward to your continued partnership. Thank you.